We've been developing a person-centred vision for the future of outpatient care for people living with multiple long-term conditions. Working closely with people living with multiple long-term conditions, we've sought to understand and map their past and current experiences of care and their future aspirations for their care. We've also engaged with the public to understand what they value about outpatient care. The insights gathered were brought to a series of co-design workshops with NHS staff across Scotland. Participants of the workshops included consultants, nurses, GPs, allied health professionals, telehealth experts and managers of different services across Scotland. We worked with staff to map the current patient experience, highlighting positive aspects and aspects of care that could be improved. We then shared stories of people living with multiple long-term conditions using the co-produced maps. Staff were asked to reimagine care for these individuals and placing the person at the centre and designing the ideal care team around them. These activities resulted in a wealth of insights and new ideas towards an integrated, holistic and person-centred vision for care for people living with multiple long-term conditions.
They only see that patient as at that point in time as well.
They have to have that conversation, and it's whether or not they've got a good enough relationship with their GP that they'll have an honest conversation with them.
I don't think it would matter so much actually if we were in silos, if the people in the silos still had the good conversations.
I really enjoyed hearing about the other stories from the other patients, what's their perspective, and it's reassuring really. When I look at this person-centred job description that they've come up with, I can see that we're not far off the mark.
I like the patient stories, they were fantastic because we can relate to that as nurses, and I think that's really important to think about the patient at the centre and think about their journey.
Felt able to talk out loud and say things and not feel it was stupid, and really be able to participate. It was really put at ease, to participate, so it was good, I really enjoyed it.
I think I've come away with a realisation that we operate within very complex systems, and yet we have the opportunity to do things differently should we wish to do them differently. However, that requires us to work together and to create time together to have that space to think differently about how we might structure our services as we go forward. The other critical piece of learning for me today has been in relation to the human behaviour element of all of this.
I thought it was very energetic and interesting and two-way actually. I thought it was good because there was an opportunity for everyone to take part.
It was a broad base of people who were here. I felt that the way that you created different areas of interaction and particularly in pursuing case histories was very informative and actually focused the mind.
It makes me feel really positive because I think we're making the right changes and I think we've still got a long way to go, but it is really good to see what the patient-centred job description, what they're looking for is certainly that we're going in the right direction.